Hey everybody, we're getting started with a brand new Cabral concept. Today's show is all about being careful of and being aware of any medications that you or a family member may be on that when you go outside and you're exposed to sunlight could end up with burns, rashes, skin sensitivities, and more. So it's really important that we understand that, of course, sometimes medications might be life-saving. They might be something that you need to use right now while you're rebalancing your body. What I can't do is provide you with any medical advice, medical treatment plans, medical cures, medical diagnosis. I always want you to help find the underlying root cause so you don't need to be on all these medications for the rest of your life. But maybe you, again, or a parent or a loved one are on these medications. You need to be aware. You have to be careful with sun exposure because it could potentially lead to more skin-based cancer from skin burns and rashes, etc. So let's go over that list right now. Let me know if you have any questions. I'm happy to always go over them. Would love to hear what you think about this topic in the comments below. Let's get started. The very first one that we want to be aware of is antibiotics. So maybe you're not on medication on a daily basis, but you had to go on antibiotics because you were having surgery, dental surgery, etc. All right. Well, while you are on antibiotics, you may be more potentially at danger for sunburns and rashes when exposed to the sun. And I'm just going to say basically light sensitivity, sun sensitivity. That's basically what we're looking at. It could result in many different things, meaning issues with eyesight, issues with skin, burns, leading to greater chances of skin cancer, etc. when you're exposed. Okay, so antibiotics is one, especially those like doxycycline and tetracycline, stronger antibiotics. All right, the next one is NSAIDs. So even though we talked about medications, most people don't think because you can get them over the counter, then NSAIDs are a medication. They are non-steroidal anti-inflammatory drugs. The most well-known is ibuprofen or brand name Advil. So if you are using an Advil, a Motrin, a naproxen, which is like an Aleve, can lead to greater photosensitivity, sensitivity to the sun. All right, next one is going to be diuretics. So if you're taking anything for high blood pressure or maybe another reason why you're on a diuretic, you have to be more careful when going out in the sun. Next one, antifungal based drugs. So you're using an antifungal because of athlete's foot, toenail fungus, yeast infection, etc. Be careful because while you're on that medication and maybe for a couple days to potentially a week or so after, you can still be sensitive to the sun. Chemotherapy drugs. So many people, obviously cancer unfortunately affects 1 out of 3 people right now. If you are using chemotherapy, you might feel good being out in the sun. You might feel good wanting to get some of that vitamin D, but be careful because you're going to be more sensitive to potentially damage from the sun itself. Antipsychotic based medication. Some of those are used for things like even anxiety, again, just being sensitive, issues with bipolar, etc. We want to just look at those medications and just be sure. You can look them up online. Whatever medication you're taking, does this increase photosensitivity? That's basically the question you're going to ask. And I think it's important. Ask your doctor, but also you can look it up and say, okay, does X, Y, and Z increase sun sensitivity or photosensitivity? All right. Acne medications. Many people are on retinoids, and retinoids can potentially damage the liver, but they can also leave you far more susceptible to sun damage. Antihistamines. I used to be on antihistamines all the time when I was a kid. And those antihistamines can increase sensitivity to sunlight. Cardiac medication. So if you're on heart-based medication, just make sure that it is not going to increase your risk of sunburns. And then sulfur-based drugs. If you know that you're on a sulfur-based drug, could increase your basically inability to process sunlight. There's a couple more that I want to share with you. So one of them that you may not think about as much is calcium channel blockers. But for people with high blood pressure and heart conditions, there are many people that are on calcium channel blockers. Again, you want to go out, you want to get sunlight, appropriate sunlight, important. I'll talk about who this may affect the most, but we have to be careful with these. Believe it or not, birth control, oral birth control, oral contraceptives can increase sun photosensitivity in some women. We want to talk about that. I'm going to talk about a little bit more. I just have like another 4 or 5 to go through, and then I'm going to talk about this. Antimalarial drugs. Now, are you on antimalarial drugs every day of your life? Most likely not. But let's say that you're traveling overseas and you decided to take antimalarial drugs. Well, when you're on those, quinine, etc., you may actually be more susceptible to sunburns. And if you're traveling overseas in an area where you're going to get potentially more sun, good to know, good to be aware of. All right. Antidepressants. We talked a little bit about antipsychotics. Antidepressants can be another one. Antivirals. Talked about this a lot, right, over the last couple of years, but antivirals might include or may include those that would leave you more susceptible to sun. St. John's wort. So the famous supplement used as an antidepressant sometimes, or to help with seasonal affective disorder, could you leave you more susceptible to that photosensitivity? And that was really the last one that I wanted to share with you. So not too many nutritional supplements would make you more photosensitive. There's a couple that might actually help with the sun. So things like vitamin C, or your detox-based supplements, or using your antioxidants, or anything with polyphenols, astaxanthin, fish oil, omega-3s, all of those could actually help you with the sun as well. So now let me just share with you, people are saying, well, I've taken these medications, I've never had an issue with sunlight, and you're correct. So what I just shared with you the ones that we know, not an exhaustive list, but we know absolutely can lead to an increase in photosensitivity, which means potentially damage from the sun, which could lead to sunburns, rashes, heat rashes, and even potentially skin cancer. All right, so we know that. Is it going to affect 100 out of 100 people? No. These things lead to a sensitivity in some people. What I've seen that is the greater that rain barrel is full, or the more genetic predisposition to this particular medication, which is creating a greater imbalance, believe it or not, in the body, can leave you then more just susceptible to the sunlight. So just understand that if you're on these medications, it might be totally fine. What would be the smart thing to do, in my opinion? It would just be to test that at a small amount. So if you're like, well, this is a medication I need to be on for quite some time, not like antibiotics where you might be on it for 5 days or 10 days or whatever it might be. And hopefully you're doing something like the CBO finish or the healthy gut support with the clean gut probiotic if you're taking an antibiotic. But again, that's neither here nor there on today's show. I've got lots of shows. If you want to go to stephencabral.com/podcast, just type in antibiotics and you'll see our protocols to help rebuild the gut after those antibiotics. But let's say you're on an oral contraceptive and or you're on a form of estrogen, which could increase that photosensitivity. Okay, so you might say, I'm going to be on this for the indefinitely, right? For the foreseeable future. So what you'll want to do is every time you switch oral contraceptive brand-wise, you'll want to test this again. But let's just say you're on the same brand. Just get 10 minutes of sun and just say, okay, did it turn my skin pink? Did I start to get any type of skin rash, anything from it? Okay, no big deal. All right, 15 minutes, no big deal. 30 minutes, no big deal. Okay, so like it doesn't, for you, may not affect you. Or you're saying, wow, it actually does. I will get a burn in half the time. Right? So it's not kind of like all or one, it just might increase the sensitivity. So you'll know that you can only get X, Y, and Z amount of sun before you need to apply a natural sunscreen, some type of non-nanoparticle zinc oxide or whatever one of your favorites are. My favorite companies are always at stephencabral.com/resources. These are the ones that I use myself, my family, in my practice. Obviously, you can use anybody that you'd like, but I always like to provide some of the brands that I'm a fan of that I found to be clean and that really do match up with more of a natural health-based lifestyle. So what I wanted to do, very simple, very straightforward, share with you, especially as we're moving into spring and of course summer, a non-exhaustive list of medications and even a little bit of supplements in there that could increase your potential for sun-based risk. For everybody else, enjoy safe sun. A lot of people are trying to tell you to get out of the sun. Don't get out of the sun. The sun is one of the most powerful things that we can use for our health. Believe it or not, it helps with hormones. It helps with detoxification. It helps with mood. It helps with so much, helps regulate circadian rhythm. So don't get a burn. Right? We don't want that. If you're worried about sun damage to your face, sure, you can cover up. You can wear a hat. You can wear your non-toxic sunscreen. All of those are fine. But If you put on suntan lotion every day and you never get a tan, you actually, doesn't matter how long you're in the sun, you're not going to get your vitamin D levels up. So in that case, you're going to need to use probably around 4,000 IUs or so of vitamin D on a daily basis. Can't provide medical advice, but if you want to find your vitamin D levels, you can of course run a lab, and the labs are just at stephencabral.com/shop. That takes you over to Equalife. You can run your own vitamin D right at home. Pretty simple, pretty straightforward. You can run it with your local naturopathic doctor or integrative health practitioner level 2. So however you want it, make sure that you're keeping those vitamin D levels elevated, not too high, but between a 50 and 70 for optimal health and well-being. Hopefully this was helpful. Appreciate all of you. All of the links that you may need will be at stephencabral.com/2979 for today's show. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.